teaching hands-on vaginal delivery technique. Where do my hands go? In the specialty of obstetrics, we have many learners that need to understand proper hand placement during vaginal deliveries. OBGYN interns, family medicine residents, ER residents, medical students, etc. Many times, it's difficult to demonstrate to learners where we want their hands placed during delivery and still allow the instructor to have full control of the delivery itself. No one knows who should sit versus who should stand. No one knows whose hands are on the baby first. In this video, we are going to demonstrate a method of hands-on-hands teaching, where the student sits and places their hands first on the baby, and the teacher stands and instructs the students by having their hands on top of the student's hands. Hand-over-hand technique. In this scene, the student is seated on the stool directly in front of the patient. The instructor is standing immediately to the side of the student to direct the student's hands. The instructor guides the student's toweled hand to the patient's perineum to provide structural support against tearing. The other hand is guided to slow and control the extension of the baby's head as it emerges out of the vaginal canal to decrease on labial tears. The instructor's hands never leave the student's hands, and they provide continuous guidance and direction. Once the head has delivered, the instructor shows the student how to allow for the head to externally rotate and look to the maternal right. Once the baby has externally rotated, the instructor then moves the student's hands to support the sides of the head, with their fingers pointing in the direction the baby is facing. From here, the instructor is still in full control over the delivery and is able to guide the student's hands in a downward, then upward motion to deliver the anterior and posterior shoulders. The student's superior hand is then directed towards the back of the baby's neck, and the inferior hand is guided to support the rest of the body as it is being delivered. The baby is then immediately brought to the mother's abdomen for skin to skin by the student and the instructor.
Switching hands. In this next scene, the baby's external rotation requires the student to switch their hand position to continue to support the sides of the head in the correct direction, with the fingers still pointing in the direction the baby is facing. The instructor is still able to smoothly guide the student's hands into the correct position while standing adjacent to the student. While the student is sitting, the instructor has the student slide further over to accommodate the hand switch. The instructor still remains in control with their hands over the student's hands during the remaining part of the delivery. This allows the student to learn valuable skills and practice efficient hand switching techniques in real time, while remaining hands-on under instructor direction.
Disengages. If the student disengages from the delivery process, the instructor steps right in to take over the delivery, and the instructor still remains in control of the baby the entire time. In this scene, the student's hands are on the baby's head, and the instructor's hands are on top of the student's. Once the student withdraws their hands, the teacher's hands remain on the baby to finish the delivery. Even if there is a shoulder dystocia, the student can move their delivery stool back, and the teaching physician can quickly and easily step in to take over the delivery while standing. We hope using this hands-on method enables you to teach your learners effectively while still maintaining control of the delivery for maximum patient safety. Special thanks to the following who helped with the making of this video.